Imagine a hurricane hits the coast. It wipes out power grids, flood neighborhoods, destroys infrastructure. The cost? Billions. The response? Immediate. The National Guard, FEMA, neighbors with boats, everyone mobilizes because the damage is visible. It is undeniable.
Now, imagine that same hurricane hits every single day, but this time it's invisible. It drains $400 billion from the U.S. economy annually. It takes 122 million Americans and places them in zones where they can't get help. It silently dismantles the workforce and overwhelms our schools. We don't call it a disaster. We call it just the way things are.
I'm Noah, and today we're talking about the epidemic that everyone sees but nobody is actually fixing. We are talking about the mental health crisis in 2025.
It's the silent hurricane, Noah, and frankly, we are running out of sandbags.
That is the voice of Eloise joining us to break this down. Eloise, welcome back.
Thank you. It's a heavy topic, but arguably the necessary one.
So I want to start with a frustration I have, and I think a lot of listeners have. Since COVID, it feels like mental health is everywhere. Every corporation has a wellness seminar. Every celebrity has a sad Instagram post about their anxiety. We are drowning in awareness.
But the user who sent in this topic asked a very specific question. How do we get it really noticed? Implying that all this noise isn't translating to action. Are we just performing awareness?
We are absolutely performing awareness. We have confused talking about feelings with building a healthcare infrastructure. They are not the same thing. You mentioned the economic cost in your intro. That figure, specifically the projection that the economic burden of mental illness in the U.S. would exceed $400 billion annually by 2025, comes from the MindForge Foundation.
400 billion. That is more than the GDP of entire countries.
Correct, and that's mostly lost productivity. But here is the disconnect. We acknowledge the cost, but we treat the cause as a personal failing or a temporary glitch. We're trying to fix a structural collapse with yoga apps and breathing exercises. The reality is, post-COVID, we aren't just dealing with burnout. We're dealing with what researchers are now calling stressflation.
Stressflation. I saw this term popping up in the 2025 reports. Break that down for us.
It's a brutal compound effect. It's the intersection of high financial stress, inflation, housing costs, and high psychological distress. A 2025 study by LifeStance and ResearchScape found that 83% of Americans are reporting financial stress that is directly deteriorating their mental health. And here is the kicker. 60% of people are avoiding mental health care because of the cost. It is a snake eating its own tail. You are stressed about money, so you get sick, but you can't afford to get well, so you get sicker and lose more money.
That is terrifying. It's an economic trap. But I want to go back in time for a second, because we often talk about this like it started in 2020 with the pandemic, but the cracks in the foundation were there long before lockdowns, right?
Oh, absolutely. If you want to understand why we have homeless encampments filled with people suffering from psychosis, or why our prisons are the largest mental health providers in the country, you have to go back to 1963.
The JFK era.
Exactly. President Kennedy signed the Community Mental Health Act. The intention was actually noble. The idea was deinstitutionalization. We were going to shut down those horrific Victorian-style asylums, which, let's be clear, were often abusive houses of horrors, and replace them with community mental health centers. Patients would live in their neighborhoods, get medication, and work.
Which sounds great on paper.
It sounds fantastic, but we did the first part. We emptied the hospitals. Between 1955 and 1980, the number of people in state psychiatric hospitals dropped by over 75%. We kicked everyone out. But we never funded the second part. We never built the community network. We promised a safety net, and instead, we just cut the tightrope.
So we essentially took people with severe schizophrenia, bipolar disorder, complex trauma, and said, good luck in the free market.
Precisely. And that legacy is why today, when someone has a psychotic break, the police show up instead of a doctor. We criminalized the condition because we dismantled the care. So when we ask, why is this issue ignored? It's because we designed a system to make these people invisible, either in prison or on the street, where we can walk past them.
That is grim. But it explains so much about the visibility paradox. We see the homeless man screaming at the bus stop and we look away, but we will share a post about Self-Care Sunday.
That is the duality of 2025.
Let's look at the youth data, because that's another area where the alarm bells are deafening. I was looking at the CDC's Youth Risk Behavior Survey data from 2024. There was some weirdly mixed news there, wasn't there?
There was. It's important to be nuanced here. The CDC did report a slight improvement in persistent sadness among teens. It dropped from 42% to 40%. So statistically, the free fall has slowed. But simultaneously, reports of violence in schools and absenteeism due to safety concerns went up.
So they might be feeling slightly less sad in a clinical sense, but they are feeling more unsafe?
Exactly, and safety is a prerequisite for mental health. You cannot therapy your way out of an environment where you fear for your physical safety. The data also showed that LGBTQ+ youth and girls are still reporting drastically higher rates of suicidal ideation and violence than their peers. So while the headline might say slight improvement, the reality on the ground in high schools is still a crisis state.
Okay, so we have the history of failed policy. We have the economic pressure of stressflation. We have a youth generation that is essentially living in a high anxiety environment. The listener asked, how do we fix this? And I don't want the soft answer. I don't want be kind to your neighbors. What is the structural fix?
The structural fix starts with the workforce. We literally do not have enough humans to treat the humans who need help. The National Council for Mental Well-Being projects a shortage of nearly 88,000 mental health counselors by 2037. Right now, 122 million Americans live in what is designated a mental health professional shortage area.
122 million. That's a third of the country.
Yes, so the first fix is not more awareness. It's drastic investment in the pipeline. We need to pay for people to become social workers and psychiatrists. We need to forgive their student loans entirely if they work in those shortage areas. You cannot have a healthcare system without providers.
That seems like low-hanging fruit for legislation, frankly. What else?
We need to adopt the no wrong door policy universally. This is something that organizations like Connections Health and the Crisis Care Access and Response Expansion Act are pushing for. Right now, if you are having a heart attack, you go to any ER and they treat you. If you are having a mental health crisis and you go to an ER, you might wait for 12 hours, be told they have no beds, and get sent home or transferred to a jail.
And that's assuming you even go to the ER. Most people don't know where to go.
Right. No wrong door means integrating crisis centers into the community so that law enforcement, 911, and families have a place to drop someone off 24/7, where they get immediate stabilization, not incarceration. It means the 988 Lifeline, which has been a good start, needs to be fully funded to not just answer the phone, but to dispatch mobile crisis teams.
Mobile crisis teams. Explain that.
Ideally, when you call 988 because your brother is manic and threatening self-harm, two people should show up, a medic and a social worker, not a cop with a gun. That changes the entire dynamic of the interaction. It moves it from a criminal justice issue to a public health issue. We have the model, we just don't have the funding in every county to deploy it.
I want to touch on something you mentioned earlier, insurance, because I feel like this is where the ignored part really stings. There are laws about parity, right? Insurance is supposed to cover mental health the same as physical health.
Supposed to. That is the operative phrase. The Mental Health Parity and Addiction Equity Act exists, but enforcement is a joke. Insurance companies use what they call medical necessity criteria to deny care. They will pay for your insulin for life, but they might only pay for 6 sessions of therapy for severe depression before asking, "Are you cured yet?"
It's like telling someone with a broken leg, we paid for the cast for 2 weeks. If the bone isn't knit, that's on you.
It is exactly like that. Fixing this means aggressive federal enforcement. It means auditing these insurers and finding them massively when they create ghost networks, lists of psychiatrists who are supposedly in network but aren't actually accepting new patients. That is a huge barrier.
Ghost networks. I've experienced that. You call 20 numbers on the list, and 15 are disconnected, and 5 are fully booked until 2026.
And by the 10th call, you just give up. And that is where the tragedy happens. The system relies on the patient's exhaustion to save money.
That is a cynical but likely accurate assessment. Okay, so we have workforce investment, mobile crisis teams, and insurance enforcement. Those are policy fixes. But the user also asked about getting it noticed by everyone. how do we shift the culture beyond the superficial?
We have to change the setting. We need to stop treating mental health as something that only happens in a therapist's office. It needs to be integrated into schools and workplaces, not as a wellness week, but as policy. For example, the Community Mental Wellness and Resilience Act of 2025 is trying to fund community-led initiatives that build resilience before disaster strikes. It's about social infrastructure.
Give me an example of what that looks like in practice.
Think about the clubhouse model of psychosocial rehabilitation. It's a concept where people with mental illness aren't patients, they are members. They go to a physical location, they work together to run the place, cook meals, publish newsletters. It gives them purpose and community. It's not clinical, it's human. In a world of isolation, connection is the strongest antidepressant.
It's giving people a role. I think that's what we strip away when we diagnose people. We label them as broken and remove their agency.
Exactly. We treat the symptoms but starve the soul. If we want to fix the epidemic, we have to rebuild the village. It sounds cliché, but the data supports it. Loneliness and social isolation are as damaging as smoking 15 cigarettes a day. You can't prescribe your way out of loneliness.
So, to bring this all together for the listener who feels overwhelmed by the scale of this, the fix isn't one thing. It's not just a pill, and it's not just a policy.
No, it is a three-pronged attack. First, policy, strict enforcement of parity and massive workforce funding. Second, systemic, the no wrong door approach with 988 and mobile crisis teams replacing police response. And third, cultural, moving from awareness to integration, building communities where mental struggles don't result in exclusion, but in support.
It feels like we are at a tipping point. The costs, human and economic, are too high to ignore anymore. The silent hurricane is getting too loud.
The levee is breaking, Noah. We can either patch it or we can learn to build boats. I think it's time we started building.
Eloise, thank you for making the invisible visible today.
Always a pleasure.
And to our listeners, if this episode sparked something, don't just sit with it. Look up the legislation we mentioned. Look at your local school board's policies on mental health. The fix doesn't come from above. It comes from us refusing to look away.